Hello, and welcome to the Smart Injury Doctors podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello and welcome to today's program. Today, what I want to talk about is the headache market. A lot of doctors want to expand their practices and they want to grow their practices, and one of the biggest concerns is new patients. A smart injury doctor and smart injury doctors in my Smart Injury Doctors program understand just how good and how valuable they are in the market because they understand how much ligament conditions cause some of the most chronic, costly, and disabling conditions in the market today. And so they're experts. They're absolutely experts at diagnosing this condition. Now, one of the things to be known is that spinal ligament injuries are the number one cause of chronic pain and disability in the market today. I'm known for promoting that and shouting that out and preaching about that to the market. It is the number one cause of chronic pain and disability in the market today. It is the number one cause of low back problems. It is the number one cause of neck problems, causing neck pain. It is the number one cause of headaches, which is a cervical condition that generates a symptom called headaches. Now, remember, whenever we're talking about diagnosis of a condition, we're talking about having the symptom and then working our way back to the most common physical cause of that condition. If you have a problem with your engine in your car, you better have a mechanic that knows how to get back to the cause of the mechanical failure and fix that so that your car is now optimally functioning again. Human body's no different. It's actually no different. So when we actually look at the U.S. headache market, it is so wide open. This is why I get so excited for smart injury doctors, because if you want to not only get in, you want to be treating more injury patients, but there's also the chronic side of things where patients have been to doctors that don't know anything about what these injuries cause, what ligament injuries cause, and so they don't know how to treat these particular conditions. And they don't know how to appropriately diagnose the condition. So let's take migraine headaches. Migraine headaches is extraordinarily prevalent. 38 million men, women, and children in the U.S. and 1 billion people worldwide suffer from some form of chronic headaches. Everyone either knows someone who suffers from migraines or struggles with migraines themselves. Migraine headache is the sixth most disabling condition in the world today. It's the third most prevalent illness in the world today. Nearly 1 in 4 households in the U.S. include someone with migraine headaches. So doctors, let me make that really, really easy. For you out there that are looking for new patients, when you drive by, if you drive by 1,000 houses tonight, 250 houses have people in those have people in that house that suffer from migraine headaches. A migraine headache patient will spend 70% more in medical expenses per year by study than somebody who doesn't. All right? So this is a very, very, very prominent condition. And the problem is every 10 seconds in America, someone in the U.S. goes to an emergency room complaining of head pain. And approximately 1.2 million visits are for acute migraine attacks. Okay, every 10 seconds, someone in the U.S. goes to the emergency room complaining of head pain, and approximately 1.2 million visits are for acute migraine attacks. And this condition is what you would consider to be rampant. Now, while most sufferers experience attack once or twice a month, right? So of that 38 million, the majority of them get a really bad migraine once or twice a month, which is bad. However, more than 4 million people have chronic daily migraines with at least 15 migraine days per month. And more than 90% of the sufferers are unable to work or function normally during their migraine. Right now, as if it needed to get any more horrific, These attacks are often accompanied by one or more of the following disabling symptoms: visual disturbances, nausea, the patient feels like they're going to throw up or they do throw up. They suffer from vomiting, dizziness, extreme sensitivity to sound, light, touch, smell, and tingling or numbness in the extremities or face. Anybody that can't emphasize with somebody that has migraine headaches is got to be pretty darn cold. But doctors, the most exciting part about this market is that there's so few experts in the market. There's so few confident doctors that know, look, as soon as that migraine headache or a chronic headache patient comes in, you need a full assessment of at least the cervical, at least the first 4 vertebrae. C1, C2, C3, C4. You need to look at the first 4 cervical nerves. Now, what are those cervical nerves? What can happen? Well, if there's a ligament injury from an old ligament injury, it'll cause excessive motion, which causes an instability. That instability causes a motor, sensory, or a pain problem associated with that motion unit, and that is the most common cause of headaches. So there's not a headache patient in the world that shouldn't have a doctor that as soon as they walk in goes, okay, what are these vertebral bodies doing right around these nerves? If I've got a C1, where does the C1 nerve come out? It comes out between the occiput and C1. It comes out above C1. Where's C2 nerve come out? Between C2 and C1. Where does C3 nerve come out? Between C3 and C2. C4 nerve between C4 and C3. So those nerves are the most common nerves that cause headaches. So the provider's got to know, is there excessive motion at these motion units that is causing a irritation, chronic irritation at that level? Any patient in the world that has migraine headaches, 50% of the migraine headache patients in the migraine headache market do not have a diagnosis. They don't trust, they don't actually feel confident that the doctor is going to be able to do anything for them. As a matter of fact, the majority of know people who suffer from migraines who can't find anybody to help them with the migraines, and they know that the drugs don't work. As a matter of fact, the drugs are now looked upon as the leading cause of chronicity in the market. So the first thing that has to be done for a migraine headache sufferer is that basically you have to get them to understand that you can diagnose their condition. You can diagnose the most common cause of their condition, and you can do it easily, inexpensively, and effectively. Now, doctors, the next thing that comes up is, what do you do for those patients? It's amazing to have doctors of chiropractic actually say, well, what can I do for this condition, when the whole profession is based on you're looking for a misalignment that's causing nerve interference. Misalignment that causes nerve interference, or mismotion of a vertebral motion unit that causes nerve interference, is called a spinal instability. That's what chiropractors are looking for. That's what they should be looking for, because that allows for standard processes to occur. If every chiropractor, every physical therapist, every medical doctor, every orthopedist, every neurosurgeon was taught how to assess the severity and location of ligament injuries standardly with stress radiology and accurate intersegmental motion testing, we wouldn't have 38 million Americans having chronic migraines. Now, again, the question comes, what do you do for it? Well, the most common treatment that you do for it is that seems to work the best in the market is called a spinal adjustment. Now, spinal adjustment, depending on the experience of the provider. Some providers would want to do that by hand. Some would want to do it with an instrument. So it depends on the experience of the providers. But what do these adjustments do? They do a couple of different things. One, they reduce down the inflammation in the area. They've been shown to do that. 2, they improve the mechanoreceptors' communication with what's called a neuromuscular control unit. So in the body, in the ligaments, there's little pressure receptors, and those pressure receptors, anytime there's any change in pressure, they immediately communicate across to the muscle system of what needs to happen to stabilize the spine at that millisecond, and for each millisecond after that. And if it's off, it causes an irritation. And if it causes an irritation, it causes the symptom, and now you have full-blown symptom, no matter what that symptom is. Today, we're talking about headaches and migraine headaches. So the first key is you got to be able to diagnose this properly. And that's the biggest thing. Like I said, for the Smart Injury Doctor, there is no scarcity of new patients, because there's so many patients out there with symptoms that have been treated by doctors who really don't know how to get to the cause of the problem. They don't know what is the most common cause and how to easily diagnose it. So this is an area of market that's wide open for doctors. There's only 500 medical specialists. I think there's like 1.2 million medical doctors in the United States. So less than 500 are considered medical specialists. And of those 500 that are medical specialists, the majority of them are just specialists with the drugs. And again, the medication overuse is now considered the most common reason why episodic migraines turn chronic. So not only does it not work, it generally shows to worsen the condition. Now, that doesn't mean, to the patient out there that might be listening, that doesn't mean when you have a migraine headache and your head is about to explode, that anybody would want a drug at that point to numb that or to bring that down. But what you really need is a doctor that can find the cause of the problem. And that's where our smart injury doctors really take over the market. That's where they get involved and can go where most doctors cannot, because they understand how to get to the cause of the condition. Doctors, this market, wide open. For those of you that don't understand ligament injuries, there's a Smart Injury Doctors program. You can go to SmartInjuryDoctor.com to learn more about it. But this condition should be eradicated. There should not be 38 million Americans that are walking around with chronic migraine headaches, or for that matter, 1 billion worldwide. Those are crazy numbers. And it's crazy because it just tells anybody who looks at it, it says, hey, there's something wrong in the market with the people that are treating these things. If the mechanics in the market got the kind of results that the doctors in the market today are getting, all you'd see on the highway is a highway filled with cars that don't work or don't function right. And we would absolutely fire the mechanics. Perhaps it's time for us to start firing doctors that cannot get results, that cannot get down to the cause, or have such complicated solutions. These solutions are simple. So, doctors, I appreciate you taking the time to listen to this program today. Again, these are short, sweet, and to the point, and hopefully something that will assist you in addressing this area in your own private practice. If you want to have the largest clinic in the world for headache recovery patients to help patients recover, you got to know ligament injuries, because they are the number one most common cause. And so in order for treatment to work, you first got to be able to diagnose. And I'm telling you, these migraine headache patients and these chronic headache patients will love you for life. 1, for finding the condition, and 2, improving it for them. So doctors, if you're having difficulty in practice today, put down why. What are the things that you're having difficulty in private practice with today? Especially if you're a doctor of chiropractic in the United States today. If you want to grow more of an injury practice, put down what you're struggling with, because that's what I'll use in the comments below to assist with further content for further programs. Doctors, I thank you very much for listening today, and I look forward to seeing you on the next podcast.
You've been listening to the Smart Injury Doctors podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review, and don't forget to join us on our next program.